Shall I start?
Yeah.
Great. Thank you, Sangeeta. Hello, everyone. Welcome again. Good evening, good afternoon, and good morning. I have a diverse group of audience, I believe so, from different parts of the world. So thank you for attending the session again today. And this is our final session in the series in the honor of Pulmonary Rehab Week. And today's topic is Mind Your Mental Health. And I'm Shakila Devi Perumal, Pulmonary Rehab and Mental Health Specialist. So thank you again to Mentoring for making this presentation possible. And I'm delighted that for your support so long for the last 2 sessions as well. And I hope to work in collaboration in future. Thank you. And this disclaimer, as I used to put in the older webinars, this presentation is not a medical advice, but an information to create awareness on pulmonary rehabilitation and mental health. Any information or approach should be used in discussion with your current provider, and the author or the mentoring make no warranty or presentation that these considerations will improve your health or prevent possibility of any negative outcomes. This presentation is prepared based on the information available at the time of preparation, and it can be superseded later by the developments in the field of pulmonary rehabilitation and mental health. So today's session, I would like to focus on explore mental health challenges for people with chronic respiratory disease and their care providers, and recognize the intersection of breathlessness with anxiety and depression in people with chronic respiratory disease, and no options for mental health activities. And finally, I want to end the session, gift you 2 mindfulness exercise at your home. So for those of you who are joining new to the session, I would like to introduce myself so that you are not actually questioning your minds and who is this person talking today about mental health? So I am a physiotherapist with 20 years of experience, specialized in pulmonary rehabilitation in Dublin for over 9 years as a pulmonary rehab coordinator and senior respiratory physiotherapist in St. Michael's Hospital, Dunleary, Ireland. And prior to that, I was also a senior physiotherapist in primary care, and it is under the HFC Ireland. And later on, I moved on to Lancashire Teaching Hospital, northwest of England, and I was a clinical lead in home oxygen service for 22 months. And following that, I thought my destination is in teaching and research, and I moved on to Cardiff University. For the past 2 years and 10 months, I'm working as a lecturer in cardiorespiratory physiotherapy in School of Healthcare Sciences, Cardiff University. I also, in addition, because I'm talking mental health, you should know that I have a qualification for it and an experience for it. So I have 15 years of experience, post-qualified as a counselor and psychotherapist, using motivational interviewing and cognitive behavioral therapy for patients recruitment and also for therapy prescription in the setting of pulmonary rehabilitation. I'm also an accredited member of the British Association of Counselling and Psychotherapy. And I also had some role in clinical research in terms of conducting clinical research and collecting data, writing up the research paper and presenting at the conference and publishing the research paper. I played that role since 2009 to 2021. And people who are very interested to look into my professional background further, I'll put a link on the LinkedIn profile, and you can click on the link to watch that, to know more about myself. So without any further ado, I'm going to go to the next slide. So today our topic is mind your mental health in relation to people with chronic respiratory disease. So our focus would be all about the mental health challenges in the population of chronic respiratory disease. So if we could question ourselves, what if you are a healthcare professional in your setting, when you see your patient with chronic respiratory disease, the main symptom they actually display is breathlessness. Alongside is anxiety and depression, which we actually, with a subjective questionnaire measurements, we gather those information. But are we really focusing on the anxiety and depression, emotional changes, just in a matter of paper, or are we targeting them better? For that, we need to be understanding what the real challenges that people are going through. And if you're a patient watching this presentation, you will be actually knowing that as a healthcare provider, we are aware of your challenges and we are trying to target to support those challenges with best possible supportive measures. So the first thing which I mentioned is breathlessness and fear cycle. So people with chronic respiratory disease have a breathlessness and fear cycle. And because of anxiety and depression and panic attacks, they have a feeling of suffocation, and that leads to an inactivity and isolation and demotivation, and that challenges their living and decreased quality of life. And also, people actually with the chronic respiratory disease, when they have, if you could recall yourself, when your doctor first presented your diagnosis that you have COPD, asthma, or fibrosis, what is your reaction? How did you respond to the diagnosis? And did you think that your doctor is actually prognosing your lifetime, number of years living? Is he actually advocating that you're going to be living 3 years or 5 years or 10 years? What was your reaction? How did you cope with those delivery of message when you received it the first time? If you could think over those things, reflect on that. An uncertain future. That is another challenge what people with chronic respiratory disease goes through when they are produced with a diagnosis, and when they actually healthcare provider says you have an uncertain future, you live only for a certain amount of years and you have to follow this, but it is incurable, which is a big shock for many people, and that actually challenges their existence, and that is a huge pressure. So people actually have this as a major mental stress management to be looked into when you're approaching as an healthcare provider, how they are coping with that news from their healthcare provider, if that is the first time news delivered to their patient. So we need to focus on those things when you're discussing the initial assessment. And there are a certain group of people where they log into the Google, and Google is a doctor, and they actually read about, once they have the news, okay, you have COPD, they go into the Google and type in, and the Google says a number of different prognoses, and different sites produce different information. And people tend to believe and start to panic as well. And that is another challenge what our group of chronic respiratory disease people go through. And because of the cycle of breathlessness and inactivity and the emotional thoughts and thinking, their daily activities curtailed, and they actually not participate in a lot of extra social activities. And this produces stamps them into a disability category, and a lack of satisfaction in their quality of life, a discontented heart. Okay, so that actually is not really good. Any of the stress linked up is going to curtail their lifetime as well. The mind and body are more interlinked. So this is another mental health challenges our population of chronic respiratory disease people go through. And the other one I would like to talk about is the oxygen stigma. So people with, yesterday we had the more oxygen, more muscle session. So I did talk about this a little bit there. So just for the new people who are joining the webinar, people with oxygen as the stigma or the myth, whether I'll be addicted to the oxygen for lifelong, or whether this oxygen is going to be any benefit, and whether any people is going to look at me and isolate me from the group because I'm wearing oxygen. So those are the different oxygen status stigma group of people with chronic respiratory disease have. And the other thing I would like to mention here as a challenge, what our people perceive is patient and family perception. How they perceive the diagnosis of if they are a caregiver, how they perceive the diagnosis given to the family member, and how they are going through the emotional challenges to manage or provide support to the particular patient, and what kind of help they can actually get for the supportive measures. So those are a big question mark, which creates a more pressure, and family pressure is also stressed on the patient as well. Patient feeling that my spouse or the partner is getting anxious because of my condition. So that creates a very stressful environment in the family situation. And the other thing is the stigma around the word of mental health. as psychologists and psychiatrists. I have an experience in my pulmonary rehab coordinator role back in Dublin, when I start to talk about the anxiety and depression, and if the people are in high levels of anxiety and depression, with the questions what we use, I would talk about approaching a psychiatrist, a psychologist, if they're not benefiting from my counseling session. And they start to think, oh my God, I would be tagged as a mental health patient, and I would go into a psychiatrist is something like end of life measure for a lot of people. And some people think that they will be isolated because they're going to a psychiatrist. People might actually stamp them, you're a dumb. So they have those kind of stigma around that, and we need to work on to make mental health as a normal as any other intervention measures for people, so that they are aware of the supportive measures and manage their quality of life in a better way, especially in our group of chronic respiratory disease. Very, very crucial. So, is fear a learned emotional response? So what happens when patients get breathless? They are actually having a fear factor, and that causes the panic attack. But naturally, isn't it, like we as a human, as an evolutionary response, we fear looking at a lion, a picture or lion vision of a lion. Some people are a fear of a spider. Some people have a fear of height. So there are different versions of evolution fear response in our body. But there was one study actually, which I will just put on the slide here, conducted in 1962, where they tried to evaluate the fear factor. How is it a trained response or an evolutionary response? So what they did was, they took patient groups and they actually put a high volume of vibration of sound. And they actually wanted the response of the patients, whether their heart rate increased, whether they actually increased breathing, whether they panicked. Nothing happened to the patient. And then what they did was they actually injected a medicine to paralyze their diaphragm muscle. A diaphragm is the main breathing muscle. So when they injected the diaphragm, the medicine to the diaphragm to paralyze the diaphragm for temporary purpose, and they saw the patients actually suffocating, getting breathless, because the diaphragm is not moving, so inspiration is not happening. So the patient was suffocating. And this was only for the trial purpose, and the patient was recovered, don't worry. So from that experiment, then they stopped they didn't inject any of the medicines after that, after a short period of time. And they actually put a high volume of sound with no injected medicine. And the diaphragm is a normal function, but still the patient started to suffocate. So this is a trained response. Why I'm saying this, what is the point of me bringing this study here to you today? So my point is, the breathlessness fear cycle is when you're breathless, your breathing is getting affected, and there is an increased work of breathing, and your accessory muscles get into action, and the dynamic inflation, a lot of air trapping happens, and your brain is trained to that response. So whenever you slightly get breathless, then your brain is actually recognizing it as a suffocation. And that's why you get more and more increased panic. And your thinking process thinks that, oh my God, I'm suffocating, I have no breath. And there is an anxiety and panic attack because of this misconception, and there is a thought of dying as well. And as a result, again, your functional activity is curtailed, and you self-isolate, and your muscles in the chest and other extremity, because you're not active, gets weaker, and you have a poor quality of life. So we need to be breaking up the cycle of the breathlessness and fear cycle. And there are a lot of mental health supports, which we'll be talking in the following slides. But my advice today would be, as an advocate for pulmonary rehab, start pulmonary rehab. That would be the best way to break the cycle of breathlessness and fear. So, what are the coping strategies our patient groups go through? So once actually a message is delivered, which is not a good news, but a bad news, that you have a COPD or asthma or pulmonary fibrosis, for example, patients go through this stages of roller coaster emotional experience. So first they have to be in a state of accepting this. So before they could get to the state of accepting, They go through denial, anger, bargaining, depression, and acceptance. But if we could think back ourselves, even ourselves, not for example of breathlessness or COPD, for any of the bad news delivered to us, do we actually go through, we all have to as a human go through these stages at one point in time. So do we all actually go through these stages in this order, or are we bouncing between denial, depression, bargaining, anger, acceptance? Think and reflect for yourself, and that applies same to your patient. So your patient will not be going through these stages, so you cannot target your intervention based on these stages. Your patient might be one day a good day, they might be accepting that they have this disease process, the other day it will be a bad day. And the patient themselves also have to accept this. One day might be a good day, another day might be a bad day. So you have to balance it and learn some coping strategies or measures, and that's what we are going to talk today. So how can we actually find out our patient group with chronic respiratory disease have poor coping skills? So what are the signs? So eating and sleeping too much, and this is not new. With COVID, most of us actually have done in the past 2 years, since 2019, are doing, okay? So I'm not doing well. I'm not good enough. I'm tearful. I'm anxious. My spouse is anxious. So these are the reference statements, what your patient will come to and say, that I'm not doing well, I'm not good enough. So you can actually find out and figure out, and if a patient is breaking down into tears frequently, then they have a poor coping strategy. So you can actually have the red flags in your discussion with the patient when they're attending your rehab session or when they're attending your outpatient respiratory clinic, how your patient is coping the disease process. As a professional, healthcare professional, we also should be mindful of our patient group feelings. So what are the depression symptoms? The major depression symptoms can be grouped under emotions, thoughts, physical, and behavior. The major emotion symptoms are sadness, anxiety, guilt, anger, mood swings, irritability. And thoughts, they might actually criticize themselves. Oh, because I was smoking, I had to end up in this state of disease, COPD. And they might actually suffer from impaired memory because of lack of oxygen or some other issues because of the aging process, whatever it is. That will be as added on a comorbidity to their disease process as well. And indecisiveness, confusion, thoughts of dying, and suicide. And physically, they have fatigue, chronic fatigue, and lack of energy, sleeping too much or too little, weight gain or weight loss, loss of motivation, and substance abuse. And in their behaviors, they will be withdrawn from others or the close networks who they were interacting before the disease process, or neglect their responsibilities, or change. They might notice that changes in their personal appearance has impacted them emotionally as well. These are the depression symptoms I would like to point out. If it resembles one of those resembles in your life pattern, be aware of it, but don't get depressed. There is a solution for everything. So clinically, what we term as depression, clinical depression, is feeling sad or feeling down every day for 2 consecutive weeks is termed as a clinical depression. Because everyone as a human have to go through anxiety and depression. There is ups and downs, but clinically you're actually fine. You have a clinical depression if you have a continuous 2 weeks of feeling down or low. So what does the research say? So untreated comorbid anxiety and depression in patients with COPD have devastating consequences. They cannot have good coping strategies, and the caregivers also get stressed up with their coping strategies, how to manage this patient, and also increases the healthcare utilization. And anxiety and depression is an important comorbidity of COPD, and that is a main target now. We are focusing in pulmonary rehab. We have actually found out we are lacking mental health support, and we are now targeting on providing more mental health support in most of the pulmonary rehab setting. And anxiety and panic attacks are more common in people with chronic respiratory disease. And depression diagnosis is 7 times more likely in people with chronic respiratory disease compared to the general population. So, what are the interventions? As I mentioned yesterday in my webinar, support group is the best way to get your anxiety and depression away out of your lifetime pathway. Okay, so you need to feel supported. Okay, that is the best way to get feeling comfortable. And counseling and talk therapy. And my advice would be starting a pulmonary rehab would be a very good option because you are in a supported network of group session and you're not alone. And there is your healthcare provider to support and listen to, and also to reflect and bounce back your questions. So that is a very good option I would recommend to people who are watching this webinar. And behavior activation. Always don't wait to feel better. There is nothing like a good day and you have to wait for that particular good day. The destination is not far away from you. You have to make it. You have to make it, whatever you're able to do, and turn that into a good day. So that is all the responsibility of the people in your hands. So that is one of the main advice I would give. I had been given in my previous practice, and I am giving to people who are now watching as well. And alternatives would be mindfulness, progressive muscle relaxation, yoga, spiritual prayers. And the final option would be the medication. So we go through each of them to the best of the extent. The support groups, as I mentioned, we all know that we are different from each other. But when it comes to a group of chronic respiratory disease, if you're in a support group, you will not feel that you're very different. Some of the similarities will align with your team members within your support group. So they can throw the perspectives, how they are managing. You can pick up some of the ideas from them. And you can also, the healthcare provider is supporting the support group as well. So you can actually get educated from them about your condition, how to cope up the condition, and what are the links, further links to reach out for the support. So support group is the very best option to tackle your anxiety or depression symptoms. A second is the counseling part of it. Okay, so I put on the link here in UK because most of the people watching from UK, but for the people who are watching from US, there is an American Association of Counseling, Psychology, sorry, and they have a very good link and reach out results. I would ask you to refer that. For the population in UK, this is the link where they have all the therapists accredited in different groups of counseling and psychotherapy. So you can actually trust that you have a trained and qualified counselor or psychologist or psychotherapist from this list of, if you click this link, you can reach out the close by resources available to your home. And the mindfulness. So mindfulness, when we come to mindfulness, there's a lot of misconception of mindfulness. And just to clear that hair here, mindfulness is not any religious practice, or it is not attached to any religious practice at all, or it's not a relaxation. It is actually a meditative practice, opposite of multitasking. You're not tasking multiple things, you're just focusing on one thing. And living in the present moment, not in the past, not in the future, but in the present moment. And it is not, as I mentioned, a religious or relaxation exercise. And there's evidence that at least a 20-minute mindful breathing improves your breathlessness in chronic respiratory disease population. So another form of supportive measure intervention for mental health is yoga. And it is one form of mindful practice. And from the mentoring, we have our best yoga teacher, and I've attended the International Yoga Day, Ms. Sujata Taladi. You can contact her if you're attending the webinar from that group. But other people, yoga is wider, and you can even have sessions on the YouTube or to your close by tutors. Just link up, and at least 10 minutes of yoga will actually clear your mind and prepare your body and ready for the day. And if people have the best times, there's no definitive prescriptive time as a best time. Your own time, morning, afternoon, evening, whatever best suits you, is the best time for you. And the final target is medication. But some people actually precede the referrals of medication before their counseling session. And in some cases, it might be beneficial because some people have very high anxiety and depression disorders, and it can be controlled partly by the medication, and so that they are not very hyper. During the counseling session, they can calm down and listen to the measures or interventions being advocated by their therapist. Who can prescribe medication? Pulmonologists, GPs, psychiatrists, palliative care consultants can actually prescribe your medication. And there is a 8 weeks program of mindfulness-based stress reduction. The Lung Rehab Voyage is going to offer that for you guys who are interested. Can contact me, and I put my email ID at the end of the session. And basically, this is a session where people can avail 8 weeks program in a private clinics or hospital setting. It can be provided individual or a group setting. The main values is you're actually inculcating a mindfulness mindset. And that's the value of that 8 week session. And people will develop some confidence and self-care, looking forward to socializing events, joyful, so breaking down that cycle of anxiety and depression, and you will be feeling revived and able to be more confident in managing yourself. That is one of the things I would like to focus on today as well. So my next slide is going to get ready in your own comfortable position, wherever you are in your house, sitting at the desk or in your living hall. Just be comfortable. It's a very quick 3-minute mindful breathing session. Just going to start that. So as you can notice, While I was doing this, I was placing one hand on my chest and one hand on my upper belly and feeling my chest moving out and in as listening to the instructions from the BGM. So focusing on only on my breath and the instructions. So this is how you practice this 3-minute mindful breathing. And I just wanted to introduce another one, 5, 4, 3, 2, 1 grounding technique, which is very a 5-minute grounding technique, which is very useful. I'll get started.
David, does it has any audio?
Yes, do you hear it?
No.
Oh,
While sharing, you have to click share sound and share.
can I actually send that link to you, Sangeeta?
Sorry?
Can I send that link to you?
Yeah.
Yeah, that would be better.
Do
Okay.
you want me to play?
Yeah. There is a link on the base of it, but I can send you now quickly. Okay.
Yeah, in chat.
Yeah.
Even the last video we was not able to see. Only the slide we was.
Is it? Oh, I'm so sorry. Okay, just 1 second. I've just sent it to you now. Sangeeta, can you play that?
The 5, 4, 3, 2, 1 method is a grounding exercise that can help you stay in the moment and avoid negative thinking and worry. You can do this exercise anywhere, at home, at school, in the car, or even in the middle of a crowd. You can do it sitting, standing, or laying down. Counting down from 5, use your senses to list things around you. Make an effort to notice details about these things. This is how to do it. Start by breathing deeply in through your nose and out through your mouth. Then slowly look at your surroundings. Find 5 things that you can see around you. Maybe you see a colorful poster on the wall. the spider web on the bookshelf, the lamp on the nightstand with the red shade, the cat sleeping peacefully on the chair, the cactus on the dresser that has finally bloomed. Then list 4 things that you can touch: the warm mug in your hands, the soft comforter on the bed, the denim of your jeans, the scratchy carpet under your feet. Next, listen for 3 things you can hear. Maybe the ticking of a clock, the quiet hum of your computer, the sound of traffic from outside. Now try to find 2 things that you can smell: the tea in your mug, the clean scent of your clothes. Finally, list 1 emotion that you feel. This is a way to ground yourself so you can feel present in the moment and in control of your surroundings. Now you try. Use this method when you feel overwhelmed to bring yourself back to the present moment.
Thanks, Sangeeta. I'll start sharing my screen now. Great. So we had watched the grounding technique, and I hope people like it. And thank you for listening today. And we made it today the final webinar session in the series for the week of pulmonary rehabilitation. And this was in honor of the Pulmonary Rehab Week from 21st to 27th June. And basically what's the main message we want to deliver in this week is we would like to give people awareness around pulmonary rehabilitation, its values and benefits. And pulmonary rehabilitation is not only an exercise program, but also mental health, and it is a multidisciplinary teamwork to support patients to improve their quality of life, not only a management of symptoms. So please share your questions, comments, and thoughts on the mentoring YouTube channel or to my email directly to the Gmail email I mentioned here, lungrehabvoyage21. And don't forget to show your support. We have a Twitter page at this minute now, fully developed and launched. Sangeeta, is it okay? Can everyone hear?
Yeah.
Okay,
Yes.
fine.
Yes.
So I thought like there was a sound coming up the background. I thought like my audio was not clear. Okay, great. So let me actually repeat that. So please share your support in the Twitter page at Rehab Lung or the Facebook page Lung Rehab Voyage. And I would actually enter my best efforts to put some response if there's any questions. And people who would like to take our program, please do email us and we can proceed further with other requirements for your program. And we will be back on next series in July. We are planning on a couple of other events in July, so we will actually inform you, and we would like your support, and also we are there to offer the service for you. Thank you for listening again.
Thank you.
Thank you very much. Thank you.
Thank you. Thank you. Bye. Thank you.
Bye now.